Hi there, my name's W.Thorburn, owner of Exclusive Hypnotherapy and the longest established hypnopsychotherapy practice in Edinburgh. Um, I'm here today to talk about hypnotherapy and also cognitive therapy. Really, hopefully the successful approaches that I've applied for the last 29 years, helping a lot of people. If we start, first of all, with cognitive therapy, this really means thought or choice. You always have a choice how you react to external events. It's not so much the situation, it's how you react to the situation that then creates the outcome, the behavior, the symptom, and symptoms from the symptoms. Whenever I do seminars on cognitive therapy, some of the participants who are other therapists are quite surprised when I tell them that sadness, annoyance, and concern are okay emotions to have. They say, but we're trying to get our clients to be super duper relaxed. And I say, well, lots of luck. If you can get a person away from depression, anger, anxiety, to sadness, annoyance, concern, they'll be able to move towards happiness themselves. They'll say, well, how do you do that? Then I say, well, most forms of human psychological problems arise from demands and inaccurate definitions. Again, they'll say, what do you mean? I'll say, well, if you were preferring to have £10 in your pocket and you only had 9, how would you feel? Concerned, they say. So, well, okay, supposing you were saying that you should, you ought, you must have £10 in your pocket and you only had 9, how would you feel? They say anxious. I say, well, notice how the emotion has moved from manageable concern to debilitating anxiety, but more specifically in the thought process, it's moved from a flexible preference into a dire need, a should, a not, or a must. It's usually closed off with an inaccurate definition, which is really a global self, other, or world rating. An example would be a student will maybe come in here to see me and say, I've got an exam coming up. That's the activating event. I feel really anxious. That's the consequence. I'll say, what are you telling yourself in your thought processes? That's a belief. Invariably, after a bit of rummaging around, they'll then say, well, I must get an A, and if not, I'm a total failure. So we have the demand, not a preference, a demand with the inaccurate definition. So naturally, because they rate their whole self, they make themselves anxious, not concerned. They're usually overly concerned by letting someone else down as well, which is usually the essence of a lot of anxiety-related problems. The person's putting themselves under inordinate pressure to please others and not make a mistake. I then maybe say to them, okay, so it is really all about choice and how you choose to react to situations or external events. I'll say if there was a plank of wood a foot wide, stretching from this wall to that wall, and I said to you, I'll give you £1,000 to walk across it without losing your balance, what would you say? No problem. I'll say, okay. What if? Note the use of the words what if. What if there was a pit of snakes underneath the plank of wood? That's different, they say. I say, but all that's really changed is your focus of attention has moved to what's relevant, i.e. the plank of wood, to what's not relevant, the pit of snakes. Life is kind of indicative of the plank of wood and the pit of snakes. It's how you choose to react to those situations. So you always have a choice. So the essence of the cognitive or rational emotive behavior therapy created by the great Dr. Albert Ellis is choice. We always have a choice. So over the series, I'll be showing you more how to flex a rational self-helping muscle and make healthy choices for you, and also how we'll back it up with good, indirect, pleasant, relaxing hypnotherapy. So in the meantime, thanks for listening. Speak soon.